So the labs that you want to know, these are all the labs that you have to have memorized, like, and just know. There's no way around it, unfortunately. So you have to know all the normal for blood pressure, for these are for adults, blood pressure, heart rate, temperature, oxygen, and the respirations, which I go over in detail in the labs training. You want to know the fetal heart rate, which I talk about in detail in health promotion and maintenance, but that's what the normal is. And then you want to know complete blood count, particularly WBC, hemoglobin, platelet, and hematocrit. Now, the thing about labs, this is the thing though, it's not just, as far as the exam, it's not really just memorizing and just knowing, being able to pick the number, the correct number. It really comes down to what do you do if it, like, what does it look like if it's low or if it's abnormal, and how do you respond? So yes, yes, we know what the WBC is between 4 to 10, but what does it mean if it's below 4? What does it mean if it's above 10? You know, so if it's below 4 and it's a WBC count, then that means that they're immunocompromised, and I have to respond. So this is the intervention part, the critical thinking part. I have to respond by, being careful to wash my hands. I have to be careful by avoiding plants from being in the room because they're risk for immunocompromisation. If it's high, how do I respond? Well, that's a sign that they could be going towards an infection. So they're going to need antibiotic. Platelets. If the platelet, yes, I know what the normal platelet is, but then if it's what does it mean if it's low? Well, if it's really low, then they could bleed. They could, literally, I could just, if they had one cut, they would just spill blood like crazy. So with that type of situation, they're gonna need platelets. You know, Uh, what does it mean if the platelet's too high? Okay, they could have a blood clot because there's too many platelets, and they're gonna stick together and form a clot. So that's what you want to be thinking. You don't want to just memorize the values, but you want to be thinking, what does it mean if it's low, and then what do I do? So the other one is electrolytes. You want to know all of them. And like I mentioned in the labs training, I go over every single one as far as what is the normals, and then what does it mean if it's low or if it's high. So you also want to know cholesterol, what's the LDL and the HDL, what's the normal glucose, what's hemoglobin A1C, which is for diabetics, right? That's when that's one of the diagnostic blood tests that we do to see if the patient may have diabetes, so you want to know what the normal is. And then urine specific gravity. So the biggest thing is that you memorize the values first. So the first thing is that you want to memorize all the values. That's the first part. Then then once you have that down, then you want to go through to the values and just know what's the low, what does it mean if it's low, what does it mean it's high, and what do I do, And and that's the best way to study. How do you intervene? So for example, low magnesium, one of the things that it does is that when patients have a low magnesium level, they'll have leg cramping, right? They'll complain of muscle cramping or leg cramping. So now you want to think to yourself, all right, and then so I would replace this by giving magnesium. So obviously the exam is not going to be do it that easy. Where it's going to ask you, oh, patient has, it's not going to be that easy. But instead it may be like you have a 26-year-old male who is complaining that he's been having diarrhea for the past 2 days. And now he's telling you that he's having muscle and leg cramping. Which lab value would you check? It would be like that. Which lab value would you monitor? And so now this is the part where you have to think about what's going on with your patient. Well, if they've been having diarrhea, that means he's losing electrolytes, right? He's losing, nutrients are leaving his body. So I have to anticipate that there's going to be an electrolyte issue. So I would first be thinking about, as far as the answer choices, I would be thinking which of these is the electrolyte, Then I would have to also know what magnesium, that magnesium is the one that would cause the leg cramping. And then I would choose magnesium as the answer. But what people do though instead is that they just memorize the labs and then that's all they memorize. They didn't memorize what it means if it's low or high. And then when they get to the answer choices, they're just literally trying to narrow between, platelets, like they're trying to narrow between two choices rather than just knowing that, just applying what they understand. So that's what I mean when it comes by the labs. So what I'll say is that just definitely watch the labs training so that way you can really master each of those specific labs. And because that's what I talk about in more detail, because you want to be thinking like that, you know. When you start thinking like that, it will easily show in how you choose the answers. It really will.